Hello everyone, welcome to Medit World. Myself Dr. Ayush Gupta. For today, the topic of choice is embryology of ear. The ear develops from the pharyngeal arches. There are total 6 pharyngeal arch, out of which the fifth pharyngeal arch disappears. The pinna is derived from mesoderm. There are 6 mesodermal thickening which are known as hallux of His. From the first pharyngeal arch, the first hallock appears, which forms the tragus. From the second pharyngeal arch, the remaining 5 hallocks appear, which forms the remaining pinna. The external auditory canal is formed by ectoderm. From the first arch ectoderm, both the cartilaginous part and bony parts are formed. The cartilaginous part is present at birth, while the bony part develops afterwards. Next, we will see the embryology of middle ear. The first bone is malleus, the second bone is incus, and the third bone is stapes. The malleus and incus are formed by first pharyngeal arch and the suprastructure of stapes is formed by second pharyngeal arch. The suprastructure includes head, anterior crura, and posterior crura. The tubotympanic recess develops from the endodermal lining. Of first pharyngeal arch. The proximal part forms the eustachian tube, and the distal part forms the middle ear and mastoid antrum. Next, we are going to see the embryology of inner ear. The inner ear consists of bony labyrinth and membranous labyrinth. The bony labyrinth is formed by mesoderm by enchondral ossification. while the membranous labyrinth is developed from surface ectoderm. This diagram here shows the development of membranous labyrinth. The first step in the development of membranous labyrinth is the formation of otic placode, which forms the otic pit, which forms the otic vesicle. This diagram here shows the cochlear aqueduct. It is the connection between inner ear and brain. Its function is to transfer CSF into inner ear to form perilymph. Infection from the brain can spread to ear via this duct and vice versa. Next, we are going to see the congenital anomalies of ear development. Aplasia. Aplasia means non-development of ear. In Alexander dysplasia, the basal turn of cochlea is affected. In Mondini aplasia, the cochlea has 1.5 turns. In Shibe aplasia, it is the deformity of saccule and cochlea. In Michael's aplasia, it is the total non-development of inner ear. Out of all the four, Shibe is the most common aplasia which is seen. Next, we are going to see about the condition which is known as meatal atresia. It is the non-development of external auditory canal. It is associated with microtia or anotia, which means deformity in the development of pinna. For the treatment of this condition, we use bone anchored hearing aid and reconstruction of pinna is done. By 6 years of age. Before 6 years, it cannot be done because the graft will be too small and also by 6 years of age we can compare it with other ear. Next condition we are going to see is known as cal oral fistula. During the formation of external auditory canal, the lateral part fuses and medial part forms the external auditory canal. If the lateral part fails to fuse, we can see a fistula near the neck known as cal oral fistula. Next, we are going to see the condition known as preauricular sinus. It is the fusion defect of first arch and second arch. It is located above tragus or at the root of helix. This was all for today. Thank you. Please like, share, and subscribe.